I am Dr. Anupam Shah, interventional cardiologist working in Sholapur. Today I will be talking about high blood pressure and alcohol intake. Alcohol has been consumed since millions of years for various reasons. Social events, celebrations, memories. The alcohol consumption, it gives a lot of fun, excitement, it relieves stress. But alcohol consumption has been recently increased. A German study has shown that in between year 1990 and now the alcohol consumption has already almost doubled, and in India the alcohol consumption since 2010 to 2017 has almost increased by 40%. So there are various reasons why we should consume less amount of alcohol. Alcohol intake and blood pressure are interrelated. The amount of alcohol we consume is very important. The lesser quantity of alcohol, the WHO recommended alcohol intake is 14 units of alcohol for men and 7 to 8 units of alcohol for women. What is the relation between alcohol and blood pressure? Alcohol intake increases the calories and in turn increases the weight. That in turn increases your blood pressure. The type of food we consume with alcohol increases your calories, and that leads to weight gain, and that again increases your blood pressure. The medications which we take for alcohol, antihypertensive medications, will be interfered with alcohol, and that itself can lead to blood pressure being not under control. So the recommended intake is 14 units of alcohol per week for males and 8 units of alcohol, because the metabolism is slow, is for females. Now what are the ways we can reduce the alcohol intake? Is by diluting the alcohol mole, reduction in the type of alcohol, because each alcohol content varies. Taking lesser units of alcohol will reduce the blood pressure. Blood pressure reduction is very important to prevent stroke, myocardial infarction, renal failure, eye problems. So hence alcohol intake we should be in moderation and lesser in quantity. Along with that, the diet you consume should contain less amount of salt and less calories. By this we can bring down your blood pressure with control of alcohol. Today I will be speaking on epidemiology of blood pressure. Worldwide blood pressure, the incidence is very high. 1.1 billion people are suffering from blood pressure. Out of that, 1.13 million deaths occur every year because of hypertension. In India itself, the hypertension epidemic is very high. Hypertension is present in 25% of the population over the age of 35-40 years, and over the age of 70 years 60 to 70% of the people are suffering from hypertension, out of which 1/5 people have never been diagnosed as hypertension in spite of having severe hypertension, and 2/3 of the patients the blood pressure is not under control. It's a very significant global epidemic which causes lot of disability in the terms of the incidence of ischemic heart disease. Coronary artery disease is 21% in hypertensive people, peripheral vascular disease is around 20%, and stroke is around 15 to 18%. So blood pressure needs to be under control. What are the risk factors for blood pressure? Strong family history is one of the risk factors. Aging population, diet, lack of good dietary habits, obesity, lack of exercise, stress. These are all the risk factors for hypertension. If hypertension is not under control, the risk of myocardial infarction, stroke, renal failure increases many folds. So hence blood pressure needs to be under control. What are the ways we can bring down the incidence of hypertension, which is a global epidemic? Is by mass screening of the patients and regularly checking the blood pressure. Blood pressure most of the times does not give rise to any symptoms. If patient comes regularly to a doctor and you check the blood pressure and find it to be high, these patients need to be treated regularly. You have to control other risk factors like diabetes, hypercholesterolemia, diet, reduction in alcohol intake, exercise, smoking, to bring down the incidence of stroke, renal failure and coronary artery disease. Blood pressure is one of the most important disease which needs to be brought under control to bring down the incidence of other diseases. Thank you.